Most low back pain is not a big deal, until it is. There are times where back pain can indicate a serious medical condition that needs immediate attention, and not knowing the signs and symptoms can lead to delayed treatment and be life-threatening. So in this video, we will review some of the most serious causes of low back pain, along with common signs, symptoms, and risk factors that can be useful in identifying the presence of serious issues. A very serious cause of low back pain that requires immediate medical attention is a condition known as cauda equina syndrome. Cauda equina syndrome occurs due to compression of the nerve roots of the lower end of the spinal cord caused by a large midline herniated disc, spinal tumors, or even an epidural abscess. It is a very rare condition, accounting for only 0.04% of low back pain cases. The cauda equina plays an important role in providing control to the muscles in the legs, as well as the function of the bladder and distal bowel. Most people will report shooting pain and weakness in one or both legs, as well as numbness around the pelvic area. A sudden inability to urinate, known as urinary retention, is a significant indicator of this condition. In more severe cases, loss of urinary and bowel control, resulting in incontinence, as well as sexual dysfunction, can develop. MRI is indicated to confirm the presence of nerve compression, followed by urgent surgical decompression within 72 hours of symptom onset to prevent permanent damage of neural structures. Cancer is estimated to be the cause of low back pain in fewer than 0.7% of cases seen in primary care contexts. The spine is a relatively common site for cancer to spread, especially for certain cancers such as breast, prostate, lung, kidney, and thyroid. A personal history of cancer has been shown to be predictive and is an important feature in those presenting with low back pain. Other risk factors include age over 50, unexplained weight loss over 10 pounds, and lack of improvement despite participating in a comprehensive physical therapy program. But if you have these risk factors and don't respond to physical therapy, a more comprehensive evaluation is likely indicated, including blood tests and an MRI. Despite its rarity, infective spondylitis is a serious condition that requires immediate medical attention. Affecting only 0.01% of individuals with lower back pain, this condition arises from bacterial infections that spreads to the spine through the bloodstream from sources like infected wounds, urinary or skin infections, or even surgery. Those who have undergone spinal surgery, particularly revision surgery, face an elevated risk of infection. The presence of fever strongly suggests infective spondylitis, but it's important to note that the absence of a fever does not rule out the possibility of infection. In cases where infection is suspected, MRI and blood tests are recommended. Treatment often involves antibiotics, and in more severe instances where spinal structure damage is significant, surgical intervention may be necessary. Spinal fractures make up the largest number of serious pathologies in the spine, accounting for up to 4% of all low back pain cases, commonly impacting older individuals, particularly women. Age is a significant risk factor, with those under the age of 50 having a lower likelihood of experiencing a compression fracture, whereas individuals over the age of 70 face a considerably higher risk. Around 12% of women over the age of 50 and up to 20% of those over the age of 70 experience vertebral fractures. What is crazy about this is that 70% of those fractures go unnoticed and are only discovered during examinations for other healthcare concerns. Various factors contribute to weakened bone structure. These factors include several elements such as insufficient dietary intake, prolonged corticosteroid use, hormonal changes, and other conditions that compromise bone density. Now, you would think a spinal fracture would be obvious and require a high trauma event. Spinal fractures often occur following only minor incidences, such as tripping, lifting, or even just sudden awkward movements. Sometimes, even an aggressive sneeze can result in fracture in those with weakened bones. These fractures often cause sharp stabbing sensations, which limit mobility greatly. When suspected, X-rays are the primary tool used to identify the presence of spinal fractures. Well, I hope you enjoyed this episode of Physio Show. You can help support our channel by giving this video a like and subscribing to the channel, so we can continue to provide you with everything you need to know about your body, how it works, and what it needs to keep moving.